welcome to the first episode of the OT Society podcast. As a disclaimer, everything mentioned and discussed in this podcast today is purely of opinion and not fact, and should not be taken as verbatim or reflection of everyone's experiences of practice. This podcast is intended to give OT students a better idea of the different areas of practice that are available in the world of occupational therapy. Some topics discussed today, some listeners might find upsetting or distressing, so if you are uncomfortable with topics of homelessness, addictions and drugs and alcohol and mental health, I advise that you stop listening to the rest of this episode. If anything that is discussed today upsets or disturbs you, please find resources attached to the page or contact us at otsociety@gcustudent.co.uk. My name is Melissa and I'm a third year occupational therapy student at Glasgow Caledonian, and today I'm joined by Emma, who is a Band 6 occupational therapist currently working in homelessness, addictions and mental health. Hi Emma, thank you so much for joining us today for the first episode of the OT Society podcast. Hi. So before we start, Emma, do you consent to this podcast being put out on our public YouTube and Spotify platforms?
Yes.
Okay. So the first question we have for you today is, what has been your OT journey so far?
So I qualified from GCU in the summer of 2019. It's quite a challenging job market at the time when I qualified. It took me quite a few months to get my first occupational therapist post, which I started in January 2020, working in acute rotations. And then the COVID pandemic hit in March 2020, so that was a bit of a challenge, and I just continued doing different rotations in ortho, cardiac, thoracic surgery and a few care of the elderly, and I'd done that for a few years before I then moved to the complex needs service in May 2022, which was the former homeless OT service, and then in August 2022 I got my promotion to Band 6, and that is my current role to date.
That's fabulous. So what is the kind of OT role in the complex needs service? Like, how does it fit into the service, would you say?
So we're a small OT team in the complex needs service. There's only 3 of us, and the way it works is every patient that comes into our service will be jointly allocated to members of the team. So it will usually be either one of us, the OTs, and then we'll be jointly allocated with a mental health nurse or a social care officer. There is also a care management role expectation in the complex needs service, so that is when you are responsible for coordinating all aspects of that patient's care, so not just necessarily like the OT input, you'll still do that, but bit of a wider role is involved as well. Then we also have some clients that are allocated to OT just for specific reasons, so we'll not take on that care management role, maybe just be a shorter piece of work. So somebody might be referred for a functional assessment or a cognitive assessment, maybe provision of equipment. We do quite a lot of housing needs assessments, supporting clients with routine and structure or engaging in meaningful activity. They're the kind of most common referrals that we get for OT.
That sounds quite like a good service. So on the back of that, so what kind of made you want to do occupational therapy?
So I really like the holistic view that OT takes, and the variety of different roles you can go into once qualified. You could be working with older people, you could be working with children, you could be working in addictions. You know, I really liked the variety of that you could go into, because I wasn't quite sure what I wanted to do, so I liked that there was lots of different options. I always knew I wanted to do something that involved working with people, and I considered a few different professions before I settled on OT. I thought about physio, or I thought about mental health nursing, but I ultimately decided on OT. I think it was my gran was visited by an OT and I didn't know what it was, and I then Googled it and I thought, that sounds like that would be a good fit for me. I've done a little bit more research, and then it went from there.
I know, I don't think lots of people know what occupational therapy is, so it's quite good that you've come on today to kind of discuss your role and everything. So like, what kind of made you want to go into this specific field of OT that you're currently in?
I was attracted to the fact that it was a new service at the time, so it had just launched as complex needs when I joined, from being the former OT service. So I really liked that, and it was a chance to be part of something new and evolving. It's quite a unique role. So we're a community outreach team. The expectation is that we will take our service to where our patients are. We're not limited to one specialty. We cover a whole group of, addictions, mental health, a lot of homelessness, physical health concerns. We quite often cross over with clients, involved in the criminal justice system, getting a lot more referrals for people with like autism or ADHD, learning disabilities. So it's really, really varied. Yeah, and I like that, when working with one client, you can cover a whole different aspects of conditions. It's not just physical health or mental health. It's quite often a mix of everything. So I really enjoy that.
Sounds like quite a good service, and it's not like a branch of OT I would ever thought that you'd be able to go into, or like I didn't really know it was there. So it's quite good that there is a service like that to help those kind of people.
It is very different.
Yeah. So what is it kind of like on a work day? What kind of does it look like for you? So what's a normal day kind of look like for you?
Every day is different. Most days I'll have a mix. So I'll always be out visiting patients in different locations. Like I said, most of our visits are outreach, so visiting clients wherever they are. Sometimes it'll be planned appointments. Sometimes it won't be planned appointments. If I'm struggling to get hold of somebody, I'll maybe just show up and see if they're in, check that they're all right. Sometimes, clients aren't in, they're not available, and you have to be quite flexible with your diary and trying to find something that works for them. Quite often spend some time in the office, doing notes, documentation, assessments, risk assessments. And then meetings, we have a weekly MDT meeting where the whole team gets together to discuss our clients. We also have OT clinical supervision on a weekly basis, which is when the OT team gets together and discuss like our new cases or discharges or just anything that we need a little bit of support with and we want some advice from the rest of the team with. So most days will be made up with some sort of combination of the above.
So you kind of mentioned there like some of the OT process. So would you say like the OT process for you is kind of mixed around, sort of like you do different stages in different orders, or?
Definitely. So when somebody is allocated to OT in our service, we'll do a handover from the assessment team who've done the initial assessment and determined that they are suitable for allocation to OT. So we would then do our OT initial assessment, do goal setting, do outcome measures, the same as you would in any kind of other OT service. And then we would move on to our interventions, and then we will quite often go back and bounce around the stages before, bounce back and forward quite a lot. We'll find ourselves reevaluating goals really often. Goals are changing, priorities are shifting, and we'll bounce around that for a little while before we eventually come to discharge and then doing our outcome measures again. So the OT process does still flow, but we move around the stages an awful lot in between.
Yeah. So on the back of that as well, you kind of mentioned as well earlier on about the different clients you work with. So what kind of like are they? So you said some like addictions, some are kind of homelessness and mental health. Is that kind of covers it all? Is there kind of more to it?
So one thing I would say that we experience with pretty much all of our clients that we work with is that they have a background of trauma. Most of our patients have a history of, adverse childhood experiences, repeated trauma throughout their adult lives. Quite a lot of them have diagnosis of complex PTSD. So being trauma-informed training, something our whole team do is really, really important because, all of our clients are affected by trauma in some way or another. They're quite often marginalised by society and they don't really fit into other services. Our clients have quite often had really poor experiences with like statutory services, like the NHS or social work. And part of our job is to try and repair that, to try and re-establish that trust so that they can eventually be moved on to mainstream services. So establishing a therapeutic relationship is key, and it can be a challenge. It can take several months sometimes. I have a client I'm working with at the moment, and it has taken, I want to say, almost 6 months for me to build up that relationship with her and get her to sit and have a meaningful conversation with me. I mean, we are eventually now there, but it's taken a really long time, and you wouldn't get that luxury in other services, and we're afforded that time to do that. And we see all different types of conditions, lots of mental health diagnoses, alcohol and substance use, addiction, a lot of people involved in the homeless system. And by that, I don't, necessarily mean rough sleeping, with a tent or a sleeping bag. Clients who are in temporary accommodation in hotels, in temporary flats, that sort of thing. That's the kind of clients that we work with.
It sounds like a really good service to help those kind of people that are kind of missed out in the different kind of health settings that we already have. So it's really good that there is that sort of service in place for that.
Yeah, very much so.
So what are kind of some of the highlights that you've had, like working in this branch of OT?
I really enjoy getting to work with clients for quite a lengthy period of time. We are supposed to be an interim service, so clients aren't supposed to stay with us forever, but we do have people in our caseload that have been there for a couple of years, so it can be really nice to get to know someone over that time and see the changes in their life. I really like not being stuck to one type of work. I kind of get to do all sort of branches of OT in this one job, which I really enjoy. It's really challenging, but it's enjoying. I like being able to establish trust with clients, and it's more meaningful if it's taking you a long time. Like the example I gave before, it's taken about 6 months, but I've got there with this one particular client. So that's a real highlight. And I really like seeing how sometimes just really small, simple pieces of work can make a big difference in someone's life. I think that's really core to OT, and just really aligns with like our person-centred values. It doesn't have to be a big, massive piece of work. It can be something really small. Might sound quite insignificant, but it makes the biggest difference.
Yeah. Sometimes you do find that though, it can be just the smaller changes that do make the bigger difference, and sometimes when you are trying to do bigger things, it doesn't seem to work as well. So that's really good. So conversely, on the back of that, what are some of the challenges you find in this setting?
So actually one of the ones I said for highlights as well is kind of having to be skilled in all aspects of OT. Can sometimes be a challenge. You feel like you have to know everything. So that can be tough sometimes. Our patients' lives are also, they're quite chaotic. Frequently moving accommodation, moving where they're staying. Particularly for clients with maybe poor mental health, or if they're using substances quite a lot, it has an impact on their presentation, which can make engagement a little bit more challenging. But it just means we have to be more creative with our assessment and our engagement techniques. So that's always a challenge, and we find ourselves having to shift ourselves a lot to suit our client. Some of our clients are also experiencing like extreme distress. They're having some of the worst times of their life, and that can be quite tough for us as staff as well. But we have a very supportive team, not just the OT team. Our wider team is very supportive. We have access to things like reflective practice and regular supervision, so that that we can talk about these things, because it can be hard going on the staff as well.
So you mentioned there you've got like your wider colleagues and stuff like that. So what are some of the other professions or services that you often work with in this role?
So in the complex needs service, we are made up of OTs. We have our nursing colleagues, both mental health and physical health nurses. We have social care workers. We have a psychology service and an advanced nurse practitioner service. We quite often cross over with other services as well. So we do, a lot of working with third sector, criminal justice, social work, a lot of work with accommodations that our service users are residing in. So it's very varied.
Yeah, that sounds so good. So would you recommend this role that you're currently working, like this kind of service, would you recommend working there, or like in kind of homelessness, mental health and addictions work? Would you recommend any kind of other OT student or OT to go into this kind of role?
Yeah, I definitely would. It's different.
Mm-hmm.
Every day is different. It's never boring.
Yeah.
And it's challenging, which is good for me. I like to be challenged. And it's evolving. We're constantly learning new things, trying to do new things. Doesn't always work, but that's okay. We've tried it, and we'll just try something else. Yeah. So yeah, I really enjoy it. I'd say it's a privilege to work in a service like that and getting to meet the kind of clients that we do.
Yeah. So if somebody was looking to go into this branch of OT, what would you recommend they do to try and get into it?
I'd say an understanding of trauma is essential, and something that I probably didn't have enough of when I started. I started in the role, but I've done lots of learning since. I think being quite a patient person would be an advantage. Progress can be quite slow in our service, so being patient, having a lot of empathy as well, being able to empathise with our clients, because they can be challenging at times.
Mm-hmm.
But it's been able to see that wider picture and being able to see why they're being challenging, and kind of going back to what I said about patience as well. Progress is slow. I think in this role as well, you have to have a really strong OT focus, and to be able to stick to your OT process. It can be quite challenging to maybe, you're sometimes pulled in other directions, particularly, if a patient's in crisis. It can be you can lose your way a little bit with the OT process, but as long as you're able to relate the work you're doing, pull it back to OT, that's a real skill to have.
Well, thank you so much, Emma, for coming onto the podcast today, because that sounds like such an interesting area of practice within occupational therapy that most people might not know even existed. So thank you so much for coming on to tell everybody that's listening today about the role in the organisation and this kind of branch of OT that you work in. So, as mentioned earlier, if you found any of the topics discussed today distressing or disturbing, please contact us at otsociety@gcustudent.co.uk or find the resources attached to the page. Thank you so much for listening today and hope you have a great day.